Hello, this is Dr. Robert Mihalich, and I would like to provide you with an overview of what to expect when undergoing corrective bunion surgery. A bunion is not extra bone that grows on the inside of the foot. It is an abnormal angulation of the first metatarsal bone that then causes the big toe to move in the opposite direction. In order to correct the deformity, the bone must be cut and then realigned. Because the bone has been cut, it requires protection to allow for healing and to prevent complications. This is an example of an X-ray showing how the bones are realigned and then held together with screws. Following surgery, plan to have something on your foot for any weight bearing for 6 weeks, which is the time it takes for the bone to heal sufficiently. We use both a stiff postoperative sandal and a more rigid walking boot. What you use depends on the level of activity. In the early postoperative period, most people use the sandal as they are not moving as much. Once the patient becomes more active, the boot is more protective and they can move more efficiently. Some patients require a fusion procedure for correction of the bunion. This is typically for severe or recurrent bunions and is called a lapidus procedure. This requires the use of a cast, and those patients need to be non-weight bearing for 4 to 6 weeks. Patients must use crutches, a walker, or a rolling type device to maintain this non-weight bearing status. For most work, plan to be off for 2 weeks to allow for elevation of the foot. This ensures good wound healing and swelling control. Submitting paperwork for disability ahead of time saves stress and anxiety after surgery and ensures timely receipt of your benefits if needed. On the day of surgery, plan to arrive 1 to 1.5 hours prior to surgery. Consider traffic and construction, which is endemic in Michigan. Upon arrival, you will meet with nursing and anesthesia who will discuss what type of anesthesia you will have. It can be a general anesthesia or a local and sedation depending on the type of correction and any associated procedures. My physician assistant and I will meet with you before surgery to mark the site, review your postoperative course, and answer any last-minute questions. Surgery can last from 45 to 90 minutes depending on the type of surgery and the number of additional procedures. Hardware in the form of plate and/or screws will be used to hold the bones together while they heal. The most common procedure I do for bunions involves using 2 to 3 screws for fixation. This is rarely removed after surgery, but can be if the hardware bothers you after healing is completed. The most common correction, which is called a scarf procedure, will require just a soft dressing that does not need to be changed unless it becomes wet or uncomfortable. Patients who have a fusion procedure or a lapidus will be in a cast after surgery and must keep it dry. Most patients will go home within an hour after surgery once their pain is controlled and they are safely mobile. Patients who underwent a scarf procedure may weight bear on their heel in the postoperative sandal. Crutches or a walker are needed only if you feel unsafe without them. Patients undergoing a fusion or lapidus procedure will need to be non-weight bearing for 4 to 6 weeks and use an appropriate device that allows them to move around safely. Elevation is key for the first 2 weeks to ensure healing of the incision, which is the most important goal during that time. Patients return to the office at 2 weeks for suture removal and to check an X-ray to ensure the correction is maintained. We will discuss progression of activities, weight bearing, and home exercise at this visit as well. Once the sutures are removed, you may shower and allow the incision to get wet. Soaking in a bath or hot tub should be reserved until the wound is tightly healed, usually at least 1 more week. The boot or shoe should be worn whenever you are weight bearing, even for short distances. If you feel strongly about returning to exercise, core and upper body exercises are acceptable. We will see you again at 6 weeks after surgery for another X-ray, and we will discuss progression of activities and weaning from immobilization. Physical therapy can be started at this time and is encouraged for a more rapid return to function and activities. At 6 weeks after surgery, you may return to all activities and shoe wear as tolerated. This does not mean that you will be able to return to all activities and shoe wear at that time. Typically, patients will start with biking, swimming, and stationary exercise at 6 weeks. More repetitive impact type exercise such as elliptical and walking can take 2 to 3 months to be able to tolerate. Running and return to competitive sports will take 4 to 6 months on average. Swelling is the last thing to improve and can take all the way up to 1 year to resolve. Most patients are surprised to hear this, but it is the truth. I hope this has given you a good overview of what to expect with your bunion surgery. Good luck, and know that we will be here for you every step of the way.